Health reporter Nicola Hill. Good to have you on the show, Nicola. Clarify for us, what exactly has the WHO said and done?
Well, every day the WHO has something called a situation report that it sends out. And as you said on Saturday, it was commenting on the plans for these immunity passports that many countries want to introduce to lessen the restrictions to people who may well have had the disease. And by having antibodies, the supposition is that therefore it's immune to a second infection and importantly are less likely to then pass the infection on to other people. So in their report on Saturday, initially, the WHO said, and their wording's very careful, it's important we listen to the wording, exact wording here was, there is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. Now, as you said, this caused much consternation, both with the public who are thinking, well, hang on a second, if I've had it once, does that not mean I'm protected? Or if I have a vaccine, does that mean I'm not going to be protected? And a lot of scientists said that the WHO was causing confusion because no evidence that it does give you immunity, but equally no evidence that it doesn't give you immunity. And because of all the consternation, the WHO then put out a clarification. And the wording they used in that was, we expect that most people who are infected with COVID-19 will develop an antibody response that will provide some level of protection, which in a way has caused even more confusion. Does it mean that you are protected or that you're not protected?
Indeed, a lot of confusion. And what do we know about immunity itself, Nicola?
Well, in answer to both our questions here, are we or are not protected, I spoke to Professor Martin Bachmann, who is an expert in the immune system. He's a professor at the University of Bern in Switzerland. And his words to me this morning were, if you've been sick, been poorly with COVID-19, there's no way you're going to get sick again with it in the near future, which I thought was quite reassuring. He and many other scientists believe that if you've had moderate to severe disease and your body has produced a lot of antibodies, you will have some immunity to getting a second infection for a while. We don't know how long that while is. And then for people who've had mild disease, or for those like in a small study in China showed very few antibodies, we have to remember that there are other parts of the immune system. There's something called cellular immunity, T cells, that also work to fight infection. And it may well be that they cleared the infection in people with the mild symptoms of the disease. And we don't know whether that produces a long-term immunity or not. I mean, we've only known about the virus for 4 months. Scientists are learning a lot about it, and there's still very much that they don't know. And the other thing Professor Bachmann said to me is, of course, how specific the tests are for the antibodies, whether they're tests against the part of the virus called the spike protein that we've seen pictures of so often, whether the antibody is fighting against that, in which case they expect it is giving protection against immunity, or whether the test is showing antibodies to a different part of the virus which might not give as much protection. And that's why there's so much research going into the actual antibody tests across the world at the moment as well.
Nicola, thank you so much for that. Nicola Hill, our health reporter, live for us there from London.